Hi, Bio 47. Today we're doing Lab 14. This is the rest of the muscles that you need to know from the unit on muscles. So we're dealing with the skeletal muscle of the trunk. The trunk of the body supports many muscles spread over a large area. They're not as densely packed as the muscles of the extremities, but because they act on broad body regions, their actions can be complex. We'll be looking at the anterior trunk muscles and the posterior trunk muscles, but a lot of these muscles can be viewed on both sides of the body and aren't found exclusively on one surface. The muscles of the anterior and the posterior trunk generally function as antagonists. For example, the inferior trunk muscles on the anterior surface are the abdominal muscles, which flex the vertebral column, whereas the inferior trunk muscles on the posterior surface extend the vertebral column. And because much of the anterior and lateral surfaces of the trunk lack bony attachments, many of the abdominal muscles will not attach directly to bones, but rather into muscles with large, flat, tendon-like structures called aponeuroses. Remember that aponeuroses and tendons are both dense, regular connective tissue that functions to attach muscles to bone. There's a primary dorsal aponeurosis, and that's called the lumbodorsal fascia, and it functions as a site of attachment for many of the lower back and abdominal muscles. And there's an anterior aponeurosis called the rectus sheath, which combines in the middle to form that distinct white line, the linea alba, or the white line, which serves as an insertion site for several abdominal muscles. And I'll show you those as we get to them. For all these muscles, the same as in labs 12 and 13, you're responsible for locating the muscle. You're responsible for knowing the muscle attachments, that is the origin and the insertion, and you have to know the primary action of the listed muscles. So let's get started. First, we're looking at muscles of the posterior trunk and shoulder. The first one that I'm going to show you is over here on the left side. That's a superficial view of the posterior trunk. So trapezius is this large trapezoid-shaped muscle, and there would be another one on the other side. It's been reflected back to show that the deep muscles. So there's one on either side forming sort of this star shape, this trapezoid shape. It's big, it's prominent, it's superficial. It has a very long origin. That very long origin starts up at the occipital bone, continues down the spinous processes of thoracic vertebrae T1 through T12. So all of the thoracic vertebrae. Then it has a more narrow insertion, but still a pretty big insertion on the clavicle and on the scapula, including the spine and the acromion of the scapula. That location should sound familiar to you because that insertion, the clavicle and the scapula, is the same as the origin of the deltoid muscle. So where the trapezius ends, the deltoid begins. Such a big muscle has a lot of actions. It can contribute to elevation of the scapula, depression of the scapula, retraction of the scapula, and rotation and elevation of the scapula and elevation of the clavicle. So it can contribute to a lot of different movements of the scapula because these fascicles are all arranged at different angles. The next one that's visible here on the right side, now that trapezius has been removed, you can see levator scapulae. There's one of these on each side as well. Levator scapulae has its origin along the transverse processes of C1 to C4, the cervical vertebrae. And this is fairly deep, so we don't really see it at the origin on the models or on the cadavers. We typically just see it at its insertion point after the trapezius has been removed. You can see it at its insertion point along the vertebral border or the medial border of the scapula. Like its name suggests, the action of levator scapulae is to elevate the scapula, so to raise the scapula. These next two over here, they're both illustrated in this sort of teal color. They both have this oblique orientation. This is rhomboid minor and rhomboid major. Rhomboid major is the bigger one, and rhomboid minor is the smaller one. We see the same pattern here as with teres minor and teres major. That is, for both the rhomboids and the teres muscles, the minor is smaller and superior, major is bigger and inferior. So the smaller, superior one is rhomboid minor. Rhomboid minor has its origin on the spinous process of C7 and T1, is last cervical and first thoracic vertebrae, and its insertion on the superior medial border of the scapula. And rhomboid major has its origin a little bit inferior on the spinous processes of T1 to T3, the transverse vertebrae, and its insertion on the inferior medial border of the scapula. And these both function to retract or adduct the scapula, and they can also, because of their oblique orientation, contribute to downward rotation, dropping the point of the shoulder. So they pull the scapula toward the vertebrae, they pull the insertion toward the origin, and they can also contribute to downward rotation of the scapula, that is, dropping the shoulder. Your lab manual for this next section goes over again those muscles of the rotator cuff. We already talked about those last lab, but you should recognize some muscles here. So you should recognize supraspinatus in the supraspinous fossa. You should recognize infraspinatus in the infraspinous fossa, and recognize teres minor down here at the lateral border of the scapula. What we can't see is subscapularis, because it would be on the other side of the scapula. Let's see. So let's keep moving and talking about latissimus dorsi. Latissimus dorsi is the widest back muscle. It's the largest muscle of the upper body. Latissimus dorsi has a really big origin. So it has its origin along all of the lower thoracic and lumbar vertebrae, their spinous processes, by way of the lumbodorsal fascia. And it also has its insertion on the lower ribs, or its origin on the lower ribs. And then the fascicles converge to have their insertion on the intertubercular groove of the humerus. So it inserts anteriorly, it runs right next to and attaches next to teres major. So they have the same action. And that action of latissimus dorsi and teres major is extension of the humerus, but also adduction and medial rotation of the humerus. So this is called the swimmer's muscle, because all three of these actions, extension of the humerus, adduction, and medial rotation, when combined, is sort of like doing the butterfly stroke. So latissimus dorsi, the swimmer's muscle. And here's all these muscles from another view. On the left is superficial, where you can see that trapezius has been removed. So we can see some of the muscles of the rotator cuff, supraspinatus, infraspinatus. The deltoid is still there with its origin at the insertion of trapezius, that is the clavicle and the scapula. We have latissimus dorsi here, attached at the spinous processes of the lower vertebrae and at the lumbodorsal fascia and the lower ribs. And on the right side, we get a deeper view showing teres minor and showing teres major, originating at the inferior angle of the scapula and inserting at the margin of the intertubercular groove on that anterior side of the humerus. Essentially the same insertion as latissimus dorsi, so they have the same action. And you can see in this view that the long head of the triceps brachii, which is headed up to the infraglenoid tubercle of the scapula, goes between and separates teres minor and teres major. Muscles that you don't have to be able to identify, but I'm going to talk about anyway, are known as the erector spinae muscle group. These muscles are making up the largest muscle mass of the back, and they consist of 3 different muscle groups: the iliocostalis, the spinalis, and the longissimus. Together, these muscles collectively function to extend the vertebral column, or if they're only contracting on one side, to laterally flex the vertebral column. They're running parallel to the vertebrae, they're deep, they're complex. We never see them on the cadavers, so we don't really talk about them in lab, but they're antagonists to the abdominal muscles and muscles that cause flexion of the vertebral column. So now we're looking at muscles of the anterior trunk, and on the patient's right is a superficial view, and on the patient's left is a deep view. So the superficial muscle of the pectoral region is pectoralis major. Pectoralis major has its origin along the sternum and the clavicle and ribs 2 through 6. So a really broad origin. And then all of these fascicles converge onto the humerus, that lateral margin of the intertubercular groove and the greater tubercle. So it's a convergent fascicle arrangement in pectoralis major. Its primary action is adduction of the humerus, but because of these fascicles that have this diagonal arrangement, it can also contribute to medial rotation and flexion of the humerus. Pectoralis major is the muscle of push-ups. If you think about what the action of a push-up is, what it's doing is bringing the humerus back toward the midline. So that's adduction of the humerus. If you think about the action of chest fly, that's also adduction. It's just in a different plane than you're used to thinking about, but it's still bringing the humerus back toward the midline. If pectoralis major were reflected back, as it is on this side, it's been cut so that you can see the muscles underneath, and there's its insertion point there, then what you'd be able to see is pectoralis minor. Pectoralis minor has its origin on ribs 3 through 5, and its insertion on the coracoid process of the scapula. Pectoralis major doesn't cross across this glenohumeral, or pectoralis minor doesn't cross the glenohumeral joint, so it can't move the arm at the shoulder. What it does instead is to move the insertion toward the origin, so that's protracting the scapula, bringing the scapula forward. Another muscle that has this same action of protracting the scapula is serratus anterior. Serratus anterior has its origin along ribs 1 through 9, and its insertion along the medial border of the scapula. So it passes underneath the scapula, passes underneath the shoulder blade, traveling between the scapula and the ribs. This is called the boxer's muscle, because if you put your hands up to block, like you would in boxer's stance, then you're using your serratus anterior, as well as pectoralis minor, which has that same action of protracting the scapula. So if you bring your hands up to block, like in a boxer's stance, then you're using serratus anterior. And over here is famous boxer Manny Pacquiao showing off some of his muscles, including these right here would be the origin of serratus anterior. So if you see somebody who looks like they have something like a six-pack, but not where rectus abdominis is, that's serratus anterior, that boxer's muscle. And it's called serratus because it looks sort of serrated or like a saw. So there's pectoralis minor illustrated here with its origin at ribs 3 through 5 and its insertion up at the coracoid process of the scapula, serving to protract that scapula. Here's serratus anterior with its origin at ribs 1 through 9. And it's also has its insertion on the scapula, but on the medial border, so it passes under the scapula and serves to protract the scapula. And here would be the sternum, and here's the clavicle. So then we have ribs 1, 2, 3, 4, 5, 6, 7, all of those true ribs, and now we're getting into false ribs starting at 8. So we're going to be talking about some of the other muscles that are attached to the ribs, and these are muscles that are responsible for ventilation, that is breathing. So the external intercostals are shown in green here, and the internal intercostals are shown in yellow here. If you've ever eaten ribs, then what you're eating is the intercostal muscles. So if next time you go to eat ribs, then what you're eating is the intercostal muscles. I've never eaten ribs, so I don't know, but apparently, if you eat ribs, then you'll notice that in between the ribs, there are 2 layers of muscle. And that's because you have one layer, the external intercostals, and that's more superficial. And then the second layer, the internal intercostals, and that's a deeper layer. So next time that you eat ribs, you can think about the intercostal muscles and their fascicle arrangements. So let's talk about internal intercostals first. Internal intercostals are responsible for inhalation. So external intercostals, inhalation. They're typically more superficial. They're more prominent on the dorsal and the lateral sides of the rib cage, so more toward the side. And they have fascicles that are anterolateral. That is, that as they're moving anteriorly, they're moving laterally, so they're diagonally outward. The internal intercostals, these are responsible for exhalation, so breathing outward. And the fascicles are anteromedial, meaning that as they're moving upward, they're moving toward the midline, and they're typically more deep. They're more prominent on the anterior side of the rib cage. Anteromedial and anterolateral is sort of a hard thing to remember or to visualize, but I have a trick that might help. So let me stop sharing for a minute. I can't figure out how to do it. Oh no. Automatic. So to remember external and internal intercostals, this also applies to external and internal abdominal obliques. What you're going to do is abduct the humerus and have your fingers out like this. If the fascicle arrangement is like this, that is anterolateral, then you're dealing with external intercostals and external abdominal obliques. If you tuck your elbows in and the fascicle arrangement is like this, anteromedial, that's internal intercostals and internal abdominal obliques. External, internal, external, internal. Whatever helps. So I'm going to show an illustration that might help with the origin and insertion and action of these intercostal muscles. So this illustration right now is just showing the fascicle arrangement of the internal intercostals. This is anteromedial. So this yellow part right here, this is the sternum. These white sections would be the ribs. So we have a rib here, a rib here, and a rib here. And then this is the fascicle arrangement for the internal intercostals. And the internal intercostals have their origin on the superior border of the inferior rib. So this would be the origin, and their insertion on the inferior border of the superior rib. So their action is to depress the rib. So they're moving the superior rib down to the inferior rib. So let me see if I can get a pen here. So this is just one fascicle, but there would be fascicles of the internal intercostals here, here. And that means that their origin is the superior border of the inferior rib. So the origin is here, and the insertion is the inferior border of the superior rib. Remember that when muscles contract, they pull the insertion toward the origin. So when these contract, they move the superior rib down. They're depressing the ribs, they're constricting the thoracic cavity and forcing air outward. What would it look like for the external intercostals? Their fascicle arrangement would be the opposite, right? It would be anterolateral. So this would be the external intercostals. The external intercostals have their origin at the inferior border of the superior rib. That would be here, and their insertion at the superior border of the inferior rib. That would be down here. When the insertion moves toward the origin, that would be this. That's going to elevate this lower rib. It's going to expand the volume of the thoracic cavity, and it's going to cause inhalation. So I apologize for my crap drawing, but I hope that helps. Last but not least, we're getting into those abdominal muscles. The first one on your list is the external abdominal obliques. The external abdominal oblique is everything out here and over here. If you look at that fascicle arrangement, remember, pull your humerus up and your fingers are hanging, and you have fascicle arrangement like this. That's external abdominal obliques. The external abdominal obliques have their origin at ribs 5 through 12 and the dorsal and lateral body wall. And they have their insertion at the linea alba, which is this white line right here, where the abdominal aponeurosis comes together. And they also have their insertion at the ilium along the iliac crest. Their action is when they contract on both sides, left and right, to flex the vertebral column and compress the abdomen. If only one side contracts, as if you're doing a bicycle crunch, that's laterally rotating the vertebral column. So this is a superficial abdominal muscle. Another superficial abdominal muscle that's just underneath this aponeurosis of the external oblique is rectus abdominis. The rectus abdominis is also considered a superficial muscle. It has its origin at the pubis and its insertion up at the xiphoid process of the sternum and ribs 5 through 7. So this is along the midline this rectus abdominis. It's two parallel muscles that are separated by the linea alba, this connective tissue strip. And it looks the way that it does because it has tendinous intersections that split the muscle into separate muscle bellies. And this is the muscle that's visible on people who have very low body fat percentages. That's where the muscle bellies can be observed through the skin and through the aponeurosis, giving the appearance of a six-pack, or potentially up to a 10-pack, depending on how much of the rectus abdominis is visible. The action of the rectus abdominis is to flex the vertebral column and to pull on and depress the ribs. So rectus abdominis also plays a role in respiration by decreasing the thoracic volume. So it's under the aponeurosis and running parallel to the long axis of the body. This has a parallel fascicle arrangement. Then over here, the external abdominal oblique has been cut away, and the aponeurosis of the external abdominal oblique has been cut away. And you can see, just to peek at right here, this is the internal abdominal oblique. And you can see the fascicle arrangement like this. That's anteromedial, that's fingers up, that's internal abdominal oblique. The origin of the internal abdominal oblique is the iliac crest and the lumbodorsal fascia, and its insertion is the linea alba, the pubis, and ribs 8 through 12, basically along the ventral body wall. Its action is when both sides contract at once, then you get flexion of the abdomen. If just one side contracts, that's lateral rotation of the vertebral column. So it's the opposite fascicle arrangement of the external abdominal oblique. So here's another view. On the left is a superficial view. This patient's left is most superficial, with that fatty tissue that's overlying the aponeurosis of the abdominal oblique and the rectus abdominis. So here you can see external abdominal oblique and its aponeurosis traveling over rectus abdominis. There's a little view of serratus anterior up there and pectoralis major. On the right side of the screen, the external abdominal oblique has been removed. So now you can see the rectus abdominis, those two parallel muscle bodies, making that six-pack because of those tendinous intersections. And then you can see by the fascicle arrangement right here that this is the internal abdominal oblique. And over here, internal abdominal oblique. And just to visualize it a little bit better, imagine that we're taking a transverse section through this person here, taking a transverse cut through the abdomen. What you'd see is this is most superficial along here. That's the skin. And then this fatty layer here. And then here's 1, 2 of the rectus abdominis on the left and the right side, with its parallel to the midline fascicle arrangement. Here's the linea alba traveling down the middle. And then on either side, layered are the external abdominal obliques, those anterolateral fascicle arrangement. Deep to that is the internal abdominal oblique with that anteromedial fascicle arrangement. And then an abdominal muscle that isn't in your lab manual, but is also present there, that's transversus abdominis. And this one is interesting because it has a fascicle arrangement that's perpendicular to rectus abdominis. And that means that it doesn't cross any vertebral joints, so it can't contribute to any movement of the trunk. It only serves to compress the abdomen and support the organs inside of the abdominal cavity. So this is just another view to get a feel for how these abdominal muscles are arranged. So now your task is to Go use visible body to examine how some of these muscles are organized. Make your flashcards to practice with origin, insertion, and action of the muscles, and get ready for quiz number 8 and exam 4.